two, one.
Welcome, everyone, and thank you for joining us today to discuss technology and hardware solutions for healthcare. My name is Brandon Sorensen with Rahi here in Fremont, California. For those who may not know us yet, Rahi is a California-based IT AV solutions provider with locations across the US and around the world. We provide a full life cycle of design, products, and services to custom fit technology needs of corporations and healthcare providers globally. Our goal for today's webinar is to provide you with the information needed to help solve any challenges you might be facing today within your unique environment. Since the start of the pandemic, we get a lot of questions around what technology and hardware can be used to improve the daily experiences of staff and patients. And how can we make that experience seamless for all users? Since every user's needs and environments are unique to what you're trying to accomplish, it's important to bring a solutions provider like Rahi Systems into the conversation early to help identify these needs and to figure out what technology and hardware will best solve these challenges for you. For today's webinar, we wanted to bring Zoom and Logitech into the conversation since these two companies have been at the forefront of solving these challenges through their products and technology and have placed an emphasis around solutions for healthcare. Their focus and goal during COVID is to engage individuals and providers with a very immersive experience while making that technology seamless for the users to use. A couple of quick house cleaning notes before we get started and introduce our panel. We do have a Q&A section in our comments section below. So if you have any questions during this webinar, feel free to place those there and we'll get to them. If you have questions after the webinar and need answers to those, you can email us at questions@rahisystems.com and we'll make sure to get those answers to you as quickly as possible. With that being said, let me introduce you to today's panel. From Zoom, we have Nicole Raymer, and from Logitech, we have Roseanne Cohen. Welcome, panel, and thank you for joining us today.
Thanks,
Let's
Brandon.
jump right into it. We know that there's a growing demand around video conferencing within telehealth. The global pandemic has accelerated the use and adoption of video conferencing technology by healthcare providers globally. As we transition to a post-pandemic phase, how do you foresee video being used in the healthcare space? And Roseanne, let's start off with you.
Thanks, Brandon. First and foremost, I'd like to just start off by saying thank you to all those healthcare heroes, hospital administrators who really helped us get through this past year. I personally have a daughter who has been working at a university medical center for the past 4 years. And I'm very aware of the sacrifices and the challenges that staff, hospital systems have faced. So I have a close connection to that, or a personal connection to that. So thank you all. But when we, as Logitech and Zoom, look at how we can help healthcare organizations move forward or leverage our technology, we like to focus in on how we can help organizations meet their quadruple aim goals. And that really drills down to how can we deliver better patient outcomes? How can we help improve that patient experience? How can we improve the clinician's experience? And how can we help deliver lower cost? Logitech is committed to ensuring that patients have access to healthcare wherever they are. With Logitech and Zoom, you can actually have that integrated video experience regardless of location, and that high definition personalized experience like you're receiving on this call today. We all are using these high definition cameras. Brandon's got a headset that gives him that privacy and blocks out noise from his environment. So again, having those devices that support that improved patient experience is really critical for a healthcare provider. And then again, making it easy for clinicians to integrate this technology, easy to use technology, plug and play, so that they're not thinking about those workflows.
We've seen a lot of new use cases since the start of the pandemic. Can you tell us a little bit more about the different use cases you guys are seeing and solving for?
Sure. Can I jump here in this one also?
Yeah, absolutely. Sorry.
Yeah. I just to kind of follow up, Logitech really is focused on empowering telehealth over 4 key areas, right? One is that patient care experience. That is that interaction between a healthcare provider and the patient, those telemedicine, traditionally known as telemedicine applications, whether it's urgent or primary care, whether it's that like a prenatal care experience, you name it, telestroke types applications. And then if you go on an administration, like what is the business of healthcare? Are you putting video conferencing in conference rooms? How are you supporting your staff do their continuing medical education credits? How are they doing their training today? And then how are maybe university medical centers working to support research and development, whether that's with working with pharmacists or in pharmacology, or are you working with medical device manufacturers? So we kind of have this entire ecosystem where leveraging video collaboration for communications really supports empowering telehealth across those 4 main areas. And then if I could just go ahead and, kind of talk about some of those great growing use cases for preparedness and response. So over the past year, the Center for Disease Control actually put out some recommendations that video collaboration could be used specifically to help prepare, prevent, and respond to the global pandemic. And so if you look at the categories or of the bucket, so to speak, of how our technology is being used to meet those CDC requirements, it falls under prepare, which is that facility communications, again, education and training on, maybe you're educating staff on the changing procedure, the changing use of PPE equipment. There might be new policies and procedures that change on a daily basis when you're dealing with an emergency. And then going in, how can you prevent this, the spread of a virus? Can we keep patients or deliver care in their homes? Or provide follow-up visits for their chronic care or their disease management that they have for those non-emergent care services. And then some key use cases that have evolved and grown over the past year have been that virtual visitations, how can we bring family members in to see their loved ones when they're being isolated? Virtual rounding, where you maybe have a telehealth cart, Logitech solutions on a telehealth cart, where you take that either around a patient rooms, you have one person take those around, or if you leave that video in the room so that you're not having to dress up your providers or your nursing staff in PPE equipment every time they need to go into that room. So these are some of those growing use cases around prevention and then responding. In the height of the emergency pandemic, there were these separate triage sites set up where you could do video assessments. Or bring in remote experts to help with, consulting or working with those key stakeholders across the state to find out what do we do next, right? How can we plan, prepare, and coordinate our response as well? So those are some new use cases that came about.
That's really interesting. And with so many new use cases, there's a tremendous opportunity to leverage collaboration tools to kind of solve these problems. Nicole, can you share with us a little bit how Logitech and Zoom work together to solve these?
Yeah, of course. Thanks so much. So as you can see here from the product category wheel, Zoom takes a video first approach to communications. So wherever you're collaborating, whether it be at home, in an office, or in a healthcare facility, we're able to deliver to you all of your enterprise communication needs and tools within a single platform that can be accessed from any room or operating system. The value that Logitech and Zoom brings is unique as we move into the healthcare space. Logitech devices are simple, easy to use, and are plug and play options that are certified to work on the Zoom platform. So at the end of the day, the providers have the confidence that they need to focus on what really matters most, the patients, and not get hung up on the technology.
Excellent. And, if anyone knows me, they know I love case studies, right? And I think case studies really tell a story from the client's perspective and help kind of set the stage and getting people thinking about, how can I apply these technologies into my space? Today, we have a case study that highlights Moffitt Cancer Center and touches upon some of the challenges that they had and what technology and hardware they used to solve that. Can we roll that case study?
Moffitt is an NCI-designated comprehensive cancer center located in Tampa, Florida. Moffitt's mission is to contribute to the prevention and cure of cancer. Just over a year ago, we evaluated our communication solutions and realized that we had a real problem.
We needed a holistic solution, a single point solution that would make it a seamless, easy to use experience for bridging the gap between locations.
One of my colleagues at USF, they were actually doing a trial of Zoom. We reached out to him and did a walkthrough of how the Zoom room was set up, and we loved it from day one.
We started with a pilot of IT of about 300 or so folks, and then we took it to 6,000 people and deployed it in a matter of 2 weeks.
Just deploying Zoom has been very easy to do. whether it's because of the platform or it's because of the excellent support that Zoom provides.
We've got one platform to support, one platform to answer questions about, and one platform to deploy.
We live in Florida, so we're in a hurricane state, so we have to be prepared every year. With the Zoom platform, being in redundant data centers allows us the ability to actually have conversations when we're under a hurricane warning.
So we are deploying Zoom rooms across our entire organization, replacing all of the legacy hardware in those rooms with the Zoom-enabled hardware.
Typically, when we do a new room, we'd have to work with our AV integrators to get it scheduled and installed. Now, if it's one of our smaller medium conference rooms, we can do it ourselves. It literally takes 30 minutes.
And we've been able to move this through the organization quicker than we ever have with any other solution. So we're initiating a pilot right now to involve our pathology teams with our OR teams, where they will be able to collaborate with each other real-time, audio and video, while the patient is in the operation. It decreases the time the patient is under anesthesia and provides us a better means of communication with our pathologist and our operating team.
We knew that Zoom was HIPAA compliant, and for us, the HIPAA compliancy is an incredibly important piece of any communication platform. Consolidating onto a unified communication platform to allow technology to enable our business, to enable our strategic plan, and to drive our research forward. Zoom enabled us to do that.
What a powerful video. I think that really touches upon, the challenges that Moffitt was facing and how they applied the solutions to really bridge those challenges and provide a better experience for both their patients and their internal staff. Nicole, let me start off with you. There's a learning curve around new technologies that are brought into healthcare, especially around hybrid environments, which it puts a lot of pressure on both the healthcare provider and the patients. How was Moffitt Cancer Center able to approach this and make it so successful?
Yeah, no, thank you for that question. And this comes up a lot. And one thing they didn't note from the video, but they did make mention of, was legacy hardware. So for Moffitt, they were using very old and outdated technology that was complicated, right? Difficult to manage and difficult to deploy. But more importantly, it wasn't easy to use when it came to the end user. One thing that they did mention in this video was that they deployed over 6,000 of these rooms in 2 weeks. And the reason they were able to do that is because with the help of Zoom and Logitech, they were able to simplify the room design and the deployment, again, making it something that could be scalable, right? It's very quick to deploy, but more importantly, keeping that end user experience in mind, regardless of room size or where those folks were working within the organization, so that it was simple and easy to use at the end of the day.
Yeah, I have to agree with Nicole. I think simple and seamless were the words that stood out to me when you start talking about large enterprise deployments. And I think that really is emphasized by how Logitech and Zoom became household names over the past year, right? Regardless of where you are practicing medicine or trying to reach your patients, whether you're in an office or in a remote space, whether you're a large health system or or individual provider, solutions need to be easy to use. They need to be plug and play. And over the past year, the pandemic really allowed our solutions to shine by giving users that plug and play experience. It gave them tools that they felt confident enough to set up with the Zoom meetings, and the Logitech solutions really worked hand in hand. And then when you start looking at a large enterprise like Moffitt Cancer Center and how you can scale, how do you scale that many rooms in that short of time? The same thing needs to, that same simplicity really needs to go across the enterprise, being simple, easy to use. But one of the things I think that stood out to me in that case study was the focus on patient outcomes. By putting video collaboration solutions between the operating room and the pathology department and having that live connection during a surgery, it really allows the patient to be under anesthesia for less time. And that provides them a better experience and a better outcome. So that really is, kind of meeting those, if we talk about meeting those quadruple aim goals, that really kind of goes back and just validates how health systems can leverage this technology to accomplish that. So great story.
And to kind of keep on the deployment theme, oftentimes we get the question around, what's the difference between Zoom meetings and Zoom rooms, especially in a healthcare setting, right? Why can't I use Zoom meetings instead of a Zoom room? Nicole, can you elaborate a little bit on what the difference is?
Of course, definitely. Yeah, this is a very common question, especially because most people have been very used to their Zoom meetings at home, right? So now going back into the workplace, really starting to think about what that hybrid work environment is going to look like for you. That's when we start to introduce the Zoom room licenses. So the difference between a Zoom meeting license and a Zoom room is that a meetings license is tied to an individual and is designed to work from an end user's edge device, like a smartphone, a tablet, or a computer with a webcam, as an example. Whereas a room, however, is designed to work with room hardware and around a physical space. Physical space doesn't have to be hardened, right, and fast to the room. It could be a mobile cart solution, but again, it's really attached to the hardware and a space itself. This type of room is typically shared between multiple users. Unlike Zoom meetings, which we've all been using again for the past year or so during the pandemic, that's tied to an individual like myself or Roseanne, for example.
Right. And then like you're seeing in this slide here, if I could just add, Nicole, jump on, is that you see the Zoom rooms. You have obviously people within a space, and you've got the video endpoint equipment placed there, and there's a single user experience, a touch control. And on the previous slide, you actually saw a mobile cart. And that too can also be a Zoom meeting room license associated with that. I'm sorry, a Zoom room license associated with that as well. So let's take a look at what that single user experience looks like. So Logitech has solutions that are small, medium, and large room configurations. But what's unique about what Logitech brings to the Zoom room experience is that single user experience with our tap device. That provides you that integrated calendaring capability. It provides you easy content sharing and really makes it easy, regardless of what environment or who's using it, to know what to do when they walk into that conference room. So that really is, again, bringing that same value of ease of use from that meeting room into the Zoom room experience.
And Nicole, just, outside of what Zoom brings into a single room environment, can you speak to a little bit what the Zoom room brings to a full healthcare system outside of just the meeting room?
Definitely. Yeah, this comes up quite a bit, especially as we talk about, what additional bells and whistles do you get in a Zoom room, right? Especially as we compare it to a Zoom meeting. Zoom and Logitech bring more than just basic room capabilities with additional features and functionality, like being able to incorporate a whiteboard and digital whiteboarding, for instance. We also bring you the ability to have room scheduling, either outside of office spaces, or could be used for things like space management, whereas we're hearing a lot of hoteling or hot desking as of recently and post-COVID, how to manage those spaces effectively. With a Zoom room, you also get digital signage, which is huge, right? Because you can have things like capacity by floor on digital signage. You could post floor plans for wayfinding so patients know exactly where to find their room, or doctors know where to find their meeting space. This is also great when it comes to language barriers. You can support multiple languages at digital signage displays as well. And lastly, but certainly not least, the use of a virtual receptionist in areas where it doesn't make sense to bring back somebody in person full time if you're not fully staffed out of the gates post-COVID. So
Absolutely.
this is, a couple last points here that I wanted to bring up. So this means being able to eliminate third-party software providers like Team, Robin, and BrightSign. Again, this is usually a pretty large cost, and you're managing these tools from multiple panes of glass. They are just a few of the items that are within your technology stack that you could consolidate down into Zoom. And this is particularly important as we return to the office post-pandemic, when users and patients want to know things like, where to find their space, how to safely enter a space when it comes to, people management, right? Making sure there aren't too many people in a particular space, knowing, what the CO2 levels are, temperature levels in a room. All of this is the back end data and reporting tools that we also build into our management tool.
And just to add on to this, because I love how this shows that enterprise deployment capability of a Zoom Room license, right? What the additional value it brings. If you look at that companion whiteboard or that Zoom Rooms for Touch, that basically is Zoom's ability to enhance a conference room or a meeting room experience or a lecture hall for a university medical center. But again, what Logitech and the way Logitech works with that environment is by making it easy and giving our customers choice. So, we talked a little bit about that Zoom meeting room, that meeting experience at the desktop, whether it's the headsets or those webcams. We even have obviously the mice and keyboards, which Logitech is known for, audio devices. We also have remote controls, that presenter devices for people who are doing those large lecture hall meeting experiences. But when it really comes down to your choice around Zoom Rooms and how you build those out, we have these simple, easy to use kits. On the left-hand side of the slide, you can actually see our Logitech Meetup. We have our Rally, and then we have our Rally Plus. And the difference between these is small, medium, and large options. And they're very modular in nature, and it can be bundled with a PC. So if you have a partnership with Lenovo or HP or Dell, and you want to use those PCs, Logitech devices can be implemented in that way, customized for your particular needs. And then if you're looking for more mobile solutions or on a cart, the Meetup obviously is a favorite, but our new appliance-based solutions offer you the ability to have either room-based or mobile solutions on either a cart for a large display or even in a small clinical environment where you can put one of our set-top systems. We have our Rally Bar and our Rally Bar Mini solutions that are new, and these are appliance-based, which means they do not require an external PC or Nook. And that just gives you a little bit more flexibility and mobility for that room environment. Just a nice, clean experience. But what you will notice is that for each of these room experiences, you have that single user experience, that tap control interface that gives any type of worker the knowledge on how to start a meeting. They walk in, they tap to join. And then if I could just kind of round that out, moving past those capabilities, I want to talk about the centralized room management capabilities that Logitech and Zoom bring. When you do roll out 6,000 video endpoints across a health system, there's a tremendous need to make sure that those systems stay updated, whether it be software updates or checking whether or not a room system is online. And how does an IT team do that and be able to scale their minimal resources that they have? And that's through centralized room management capabilities that Logitech brings with our sync software that allows you to do device management, push software upgrades over the cloud. It also allows you to do room counting, so you can actually identify how many people have been using. It actually doesn't capture their faces or store it anywhere, but it does allow you to count the number of participants in that room environment. So again, giving your IT teams the ability to easily deploy as well as manage these room systems is critical when you are having these large scale deployments. So I just wanted to highlight those features.
No, that's great. And, kind of staying on the topic of ROI, we heard about how Zoom can consolidate your spend on some of the other subscriptions you may have in your environment by just adding those into their services. What other programs and assistance is available through Logitech and Zoom to help find the funds available outside of this, just to deliver these solutions into their environments?
I could actually take this one, Brandon.
Yeah. Go ahead, Roseanne. Sorry.
So Logitech has last year, Logitech rolled out what we call the Grant Services Program. And the Grant Services Program allows healthcare organizations to work through Rahi to find out what grants are available to provide supplemental funding for their technology needs. And so it could be for technology for a room system. It could include your displays. The Logitech software, it can include your Zoom Room licensing as well. And Logitech works with Rahi and the customer to find out and do searches for all of the grants that are available for that organization to apply for. The grants process is a little bit longer process. It's a 6 to 12 month process, depending on which one you're applying for. However, with all of the stimulus funds that have been passed into law from March of last year to the second round in December and to the one that we just saw this month, Logitech has been working with healthcare systems to build their applications for stimulus funding, to inform them on the gotchas, like what are the reporting requirements, how do you build out your application, the use cases. So those are items that our funding experts, along with Rahi, can help guide healthcare systems through. What is the right appropriate funding to use for your technology needs? And again, we can help you through stimulus, and then we can help you with your long-term supplemental funding needs within the healthcare organization.
And that's a good point, and before we roll into our Q&A section, I think it's important to also state here that, as a solutions provider like Rahi or Logitech or Zoom, we engage in these conversations every day. We talk to end users, we go through these motions, and it's what we enjoy and really, why we're here, right? It's the collaboration side of it that we enjoy the most in delivering this technology, and having these conversations upstream and really understanding your use case and what you're trying to achieve in your environment. We've seen what the good and the bad is on both sides of that. So really engaging a solutions provider like Rahi, working with partners like Logitech and Zoom, we can really ensure that your environment is successful for both users and your employees and the patients, right? So I encourage you, whether it's Rahi or another solutions provider, make sure you're engaging early, making sure you're having the conversations and bring them into the fold so that you can really get a solution delivered that is beneficial for everyone, and make sure that your spend is used accordingly. With that said, we have 5 minutes here for questions. Simon, do we have any questions in the Q&A?
The first question being, does Logitech have a mobile cart solution for healthcare environments specifically?
Okay, well, I can answer that in a couple ways. Well, we do not have a cart solution. However, Rahi is our integration partner who can actually build a cart solution for you with Logitech devices. So Logitech has obviously our set top, our Meetup is one is typically integrated with something like maybe an Ergotron cart or a Triton cart. There's a number of different cart manufacturers that are out there, and Rahi would be your integration partner to bring that total solution together. Typical solutions that you'll find on a mobile cart solution would be the Logitech Meetup, a Logitech keyboard and mouse, and then Rahi would bring that together with the Zoom license and all the other components to deliver a full-on solution. Yes and no.
The second question we have, what are the typical license lengths for Zoom Room licenses or Zoom Meeting licenses?
Yeah, great question. So customers have a number of different choices when it comes to licensing for rooms or meetings. You could go with a single year agreement with us, or you could do a 2 or 3 year bundle. Now we also have something called enterprise licenses available as well too. So if you're already a very large meetings customer of Zoom and you want to add on things like Zoom Rooms or maybe Zoom Chat or Zoom Webinar, you could also go as far as adding Zoom Phone for those that aren't familiar. So it's a full enterprise package for all your UCaaS. Now, when it comes to licensing itself and purchasing the licenses, Rahi is a great outlet for doing so and helping you manage those in the deployment of your phone systems or rooms.
We have no further questions at this time.
Excellent. Thank you, Simon. Appreciate it. And thank you, panel. Thank you, Nicole and Roseanne, for joining us today and educating us on the abilities of both Zoom and Logitech. Today we've talked a lot about how Logitech and Zoom can simplify the experience for healthcare providers and patients. If you have a need for any of these solutions or just want to know how to optimize your current space, reach out to us here at Rahi. We have the experience rolling out both Logitech and Zooms in a variety of room sizes, both big and small. Bring us in for your next project and allow us the opportunity to deliver a better experience for both patients and staff. Reach out to us via email or give us a call and we'd be happy to help. Thank you again for joining us today, and be well.